A very good evening to everyone. I am Dr. Vibhavri Naik, consultant anesthesiologist from Basavatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. On behalf of the entire team, I extend a very warm welcome to all of you here today for the webinar on career opportunities for young anesthesiologists. Now, completing the 3-year training in anesthesia is just the beginning of the journey in becoming a successful anesthesiologist. But I'm sure many of you have faced this question. Should I continue and do some degree further? Do I need to do a fellowship or should I do a DM course? What specialization should I choose? And if you're already doing a specialization, then after you finish, where should I join for work? Should I continue in the same academic institute that I am currently in, or should I join a corporate hospitals? And many more similar questions. So for the next 2 hours today, we intend to demystify these paths and routes. Myself, together with my 2 co-moderators, Dr. Balavenkat Subramaniam and Dr. Pradeep Dongre, and the entire illustrious panelists, we will try and answer some of these questions. To introduce Dr. Balavenkat, probably he doesn't need an introduction. We all know him for his enormous work in the field of regional anesthesia. The single institute where highest number of surgeries are done under regional anesthesia every day. The institute where highest number of regional anesthesia fellows passed out every year. We know his organizational skills when we attend GARC, which is considered as a holy pilgrimage by many. He's an excellent orator and has delivered more than 500 lectures, many of which have been circulated far and wide. So without mentioning anything more about him, because that would really take a very long time, I move on to introduce my next co-moderator, which is who is Dr. Pradeep Dongre. Dr. Pradeep is an assistant professor at the ESI College, Rajaji Nagar. And apart from his achievements, what really impresses me the most is his exceptional knowledge in the field of research methodology and statistics. And that is one of the reasons why we got together to conduct this survey on career opportunities for the young anesthesiologists, which I'm sure you would have crossed by, which was rolled a couple of weeks earlier, and we'll talk about it a little later. With this as prologue, I now hand it over to Dr. Bala for him to share his views on this very important topic and also to introduce our other illustrious panelists. Over to you, Bala, sir.
Thank you so much, Dr. Vibha. I deem it a great pleasure and privilege to moderate a session of great relevance for the young anesthesiologist of today and tomorrow. At the outset, I would like to congratulate each and every young anesthesiologist for having chosen anesthesia as their choice and as their profession. I personally believe that anesthesia could be called the mother of modern medicine because we are the only one who read right from what happens to a human intrauterine up to geriatrics. Entire biochemical, microbiology, pathology, anything you name it, we are the ones who read it much more than any other specialization. So we are holistic, and I would call it as mother of modern medicine. And when any patient who comes into the hospital for a surgical procedure, he has only 2 things in his mind. Number one, whether he would survive the surgery and especially anesthesia and whether he'll remain alive. And the second important thing is how much will be his intensity of pain. So God created human life and he created anesthesiologists to preserve that life. He gave the power to prevent death to an anesthesiologist. He created pain and he created an angel in the form of an anesthesiologist to alleviate the pain. So I would congratulate all of you for being an anesthesiologist. And I'm sure that in the years to come, we will go to very high pedestal among the specialty of medicine. Today's webinar assumes great significance because when you complete, there are several opportunities that are available to you. There are several specializations that are available to you. And it becomes pertinent that we need to give you insights into what would your life be if you choose this path. To give a lucid answer and to decipher several of your question marks that you have. We have such eminent faculties representing all the different walks of life in the anesthesia. So they're going to give you a pathway that you could choose based upon what you garner from this webinar. This would be a life-changing moment for you. And may I request all of you to be completely focused, grasp every single point that the renowned specialists are mentioning here. And I'm very, very happy that all these people of tremendous repute who have established themselves professionally in their respective specialization and super specialization in anesthesia for giving their time and for being with us. Thank you, Dr. Vibha and Dr. Pradeep, for curating this session so very well. Pradeep for initiating the survey. And I'm very, very happy that Dr. Vibha, who is the senior consultant onco-anesthesiologist and intensivist at the Indo-American Cancer Hospital in Hyderabad, who has done extensive work in onco-anesthesia, pediatric anesthesia, and area of interest is vascular access. And thank you so much for curating this session and congratulate you for taking over as the Secretary General of the esteemed body, the ASPA, the Asia Pacific Pediatric Society. Thank you, Dr. Vibha. I have great pleasure in introducing Dr. Balabhaskar, the past president of Indian Society of Anesthesiologists, who has phenomenally contributed to the upliftment of Indian Journal of Anesthesia from WIMS Bellary. Sir, thank you so much for being with us and for accepting to share your thoughts and views with us. And the best thing that we like about you is your contribution to creating Indian guidelines. When everyone quotes everything, the American guidelines or European guidelines, you have given us the pleasure of quoting Indian guidelines, and you have been part of 5 such guidelines. May I request all the panelists to keep their video on. And when I introduce, maybe you can greet so that you will be spotlighted. Welcome, Dr. Balabhaskar, sir. I have great pleasure in introducing my senior resident from whom I learned anesthesia, Dr. Pankaj Gupta, who's a member of the Governing Council of Indian Society of Anesthesiologists, currently serving his 3-year term, and one of the busiest private practitioner of Nasik, who has done phenomenal work in several specializations of anesthesia at the private hospitals, who goes to prove that good work can be done in private institutions, provided you develop a good culture. And he was very crucial in planning the Kumbh Mela disaster management program in Nasik, and very vibrant in Indian Medical Association and the Private Practitioners Forum of Indian Society of Anesthesiologists. Welcome, Dr. Pankaj.
Thank you, Bala.
Yeah, I have great pleasure in introducing Dr. TVS Gopal, who is the founding director and the managing director of one of the biggest anesthesia conglomerate in India, the Axon Anesthesia Associates. He's also the clinical director of anesthesiology at Care Hospital, Hyderabad. He's a very passionate regional anesthetist, and I'm very happy to say that 5 of us were the founding members of Academy of Regional Anesthesia of India, and Dr. TVS Gopal was highly instrumental and one of the 5. I request Dr. TVS Gopal to greet the delegates. I have great pleasure in introducing my junior in BJ Medical College, Pune, and one of the doctors, anesthesiologists who climbed great heights by becoming an entrepreneur. So he has, to his credit, now more than 2,000 clinical beds in the southern part of India. He's the director of Kaveri and one of the directors of Kaveri hospitals, which are spread over several cities in southern India. And he's also the founder of one of the most popular medical exhibit, industrial exhibit in this country called the Medicall. Thank you so much for being with us. And he's also a certified NABH assessor, and he's a Six Sigma champion. Thank you so much for being with us, Dr. Mani.
Thank you, sir. Thank you.
I have great pleasure in introducing our good friend and the encyclopedia of modern anesthesia teaching, Dr. Ranjit Karthikeyan. He has got RAA online, and he has done phenomenal contribution to the development of pediatric cardiac anesthesia in the Sri Ramachandra Institute of Medical Science. And apart from that, he has immensely contributed his time in developing multiple modules, and he has been a visiting faculty in several places across the globe, including Malaysia, Singapore, and the Gulf. Thank you so much, Ranjit, for being with us. Welcome, Ranjit. I have great pleasure in introducing one of the finest neuroanesthesiologists of this nation, Dr. Joseph Monteiro, who is a consultant neuroanesthesiologist and the program director for neuroanesthesia and neurocritical care program. And he's the scientific research committee member of the PD Hinduja Hospital and Medical Research Center, Mumbai. He dedicated his life for neuroanesthesia and is phenomenally contributed both to the literature and for promotion of neuroanesthesia and neurocritical care in this country. We welcome you, Dr. Joseph Monteiro.
Thank you, Dr. Bala.
Thank you, sir. And I have great pleasure in introducing yet another very good friend, Dr. Sunil Pandya from Hyderabad. Dr. Sunil Pandya has done his PDCC in cardiac and neuroanesthesia. After that, he did postdoctorate fellowship in obstetric anesthesia. Here you see a rare combination of a person who has done cardiac and neuro specialization, but has become an doyen in obstetric anesthesia of India. He's the chief in the Department of Anesthesia and Perioperative Medicine and Critical Care at AIG Hospital, Hyderabad. And he also has been one of the important people in the development of Association of Obstetric Anesthesia in this country. Several awards and accolades followed him. Welcome, Dr. Sunil Pandya. I have great pleasure in introducing Dr. Nandini Dave. Dr. Nandini Dave is a senior consultant and head in the SRCC Children's Hospital, Mumbai. She was the former professor and head department of pediatric anesthesia in the very esteemed institution, KM Hospital, Mumbai. He served in several positions in IAPA, the Indian Association of Pediatric Anesthesia, more than 100 publications and 22 original research articles. Dr. Nandini Dave, we are extremely delighted to have you with us to enumerate about the specialization of pediatric anesthesia.
Thank you. Thank you, Dr. Bala.
I have great pleasure in introducing yet another stalwart in India who has made a mark for himself in regional anesthesia, Dr. Sivashanmugam, who works as the head of the Department of Anesthesia at Mahatma Gandhi Medical College and Research Institute, Pondicherry, runs several fellowships for ultrasound-guided nerve block, and he's an invited faculty for several national and international forum and heads the Board of Studies of Academy of Regional Anesthesia of India to create the curriculum and the exams. Welcome to you, Dr. Sivashanmugam from Pondicherry.
Thank you very much, sir. Thank you.
I have great pleasure in introducing Dr. Jyotsna Goswami. And she's a senior consultant head, Department of Onco Anesthesia at Tata Medical Center, Calcutta. She's the current president of Society of Onco Anesthesia and Perioperative Care. She's also the past president of the ISA Metro City branch of Calcutta. I like her the most because of her passion to publish books, and she has already done 2, and she's going to do 1 more, which is going to come. We have great pleasure in welcoming you, Dr. Jyotsna Goswami from Calcutta.
Thank you, Dr. Balavenkat. Thank you very much.
Thank you, madam. I have great pleasure in welcoming one of my juniors at BJ Medical College and who is doing pioneering work in palliative medicine, Dr. Anjum Khan Jodh from Jaipur. She's director of the Department of Anesthesia and Palliative Medicine, and she has done phenomenal contributions as heading this department at Bhagwan Mahavir Cancer Hospital and Research Center, Jaipur. She's an invited faculty both nationally and internationally, and she spearheads her work currently in palliative medicine. She's going to contribute to the young minds to know more about palliative care. And I'm very happy that she's also an alumni of BJ Medical College, Pune, where I also studied. Welcome, Dr. Anjum Khan Jodh.
Thank you, Dr. Bala.
Thank you so much and welcome. I have great pleasure in welcoming Dr. Sunita Lawange. She's a consultant pain physician and the president-elect of the Indian Society of Study of Pain. She was the president of Indian Society of Study of Pain and Indian Society of Anesthesiologists, Nagpur. And she's successfully running her private pain center. And today she's going to give a lot of insights on how an anesthesiologist can be an excellent pain physician. Welcome to you, Dr. Sunita Lawange.
Good
from
evening,
Nagpur.
all.
Yeah.
Good evening, all. Greetings from Orange City, Nagpur. Thank you so much, Dr. Bala,
Thank
for the
you.
wonderful introduction.
Thank you so much. And I have great pleasure in introducing another doyen in the field of anesthesia and critical care, Dr. Sheila Maitra. She is one who has accomplished a lot, and she currently heads the Indian Society of Critical Care Medicine. She's the current president, and she's the one who has put India in the global map on several occasions. And she contributes phenomenally to the educational initiative of the World Federation of Society of Anesthesiologists. And she has been the mentor for several students in critical care. She's doing yeoman work at the Tata Memorial Cancer Hospital in Mumbai. She's got several awards to her credit, and she is, I think I wanted to mention, she delivered the William Shoemaker Oration at the Society of Critical Care Medicine 2023 in San Francisco, USA. And she has been awarded the American College of Critical Care Medicine. Dr. Sheila Maitra, we know that you have several hats that you're wearing, but still you made it a point to be with us this evening. Most welcome to you.
Thank you very much, Dr. Bala. Thank you.
I have great pleasure in welcoming Dr. Venkatesh, the registrar of MS Ramaiah University. He is also a Senate and Syndicate member of the Rajiv Gandhi University of Health Services. He was also the Director of Medical Education and Government of Karnataka. Thank you very much for joining us, sir.
Good evening, Bala. Thank you very much for introducing me.
I have great pleasure in introducing Dr. Lulu Sharif, who has completely dedicated her life for simulation. She's the Professor of Anesthesiology and Head Department of Healthcare Simulation Education at Father Muller Medical College, Mangalore. She is the first applicant from India to get certified as an advanced healthcare simulation educator from the Society of Simulation in Healthcare. We are extremely happy and proud to have you with us, Madam Lulu Sharif. Welcome to this webinar. Thank you so much.
Thank you so much, sir.
Thank you, madam. Welcome, madam. And the last but not the least, I have a very interesting person, Dr. Avnish Kare, this young, vibrant, dynamic anesthesiologist, chose to take the path of the buzzword of the world, artificial intelligence, as his profession. So for the young minds to know more about what it means to be an anesthesiologist and a person who can take AI as his career, here we have Dr. Avnish Kare, who is currently in Udaipur. So with this galaxy of panelists, we are all set to learn from each one of them. And I would be 100% sure that all the young minds who are listening to these experts who have walked the path and who are going to share their experience and expertise, making sure that you take a path that would be closest to your heart from what you listen from today. So thank you so much for all of you. And I hand over the proceedings to Dr. Pradeep, who did a phenomenal work in conducting a survey to know what the young minds think about their career opportunities in this country. So this is a very, very well curated webinar, and the entire webinar is based upon what you told us. From that, we have come to curate this webinar. Over to Dr. Pradeep Dongre from Bangalore.
Thank you very much, Bala sir, and good evening, everyone. And it's a pleasure to see such a wonderful galaxy. I'll be sharing some slides now. We conducted okay. Good evening, everyone. So it's a pleasure to be here. And the question which arose in our minds while we thought about this webinar is, we really don't know what the youngsters want. And to answer this question, Dr. Balvenkat, me and Dr. Vibha sat together and we decided that it's better to have a short survey or to know the opinion of our youngsters on what they actually wanted to know. So this whole webinar is based on the results which we got from our survey, and this is going to be published shortly. So, so this is the survey that we did, survey on career opportunities and guidance among young anesthesiology graduates. So, so why the background of the survey was, there are so many options. You have private practice, you have corporate hospital practice, you have a medical colleges, or you have further studies to go to. So where do you want to go to? So this was some of the backgrounds, and we wanted to know the opinion of our youngsters. We wanted to know, we also thought of the fact that most of the youngsters, their aptitudes are not determined. We don't know whether they have the aptitude for that particular course. And so we tried to ascertain young anesthesiologists' knowledge, attitude, and their career options in this survey. So what we did was, we created a survey questionnaire. We did the content validation for that. We had around 7 experts who gave their valuable opinion. Then we went on to distribute this survey using Google Forms through various social media platforms. The basic idea was, we didn't have a concrete database of young anesthesiologists who had graduated less than 5 years back. So they had completed their MD anesthesia less than 5 years back, and we wanted their opinion and their opinion alone. So this survey was not concentrated on postgraduates. So what we did, even then, we didn't have a database of such young anesthesiologists. So what we did was, we circulated this questionnaire in the social media, in WhatsApp groups, in all our groups, various groups. And once we got the answers, we started eliminating those which did not meet the inclusion criteria. So they were between 1 year to 1 year after graduation to 5 years after graduation. Those were included. Then those who are less than 27 years old, we felt that they would probably not have completed their post-graduation, and still they would want to know. So we said the webinar will definitely cater to them, but as a survey, we would like to target and take the opinion of those who had already graduated. Then, and some of them had actually declared that they were pursuing post-graduation. They were 61 in number. So totally we analyzed around 426 responses. So there were, this is the mean age of the respondents. It was 31.4 plus or minus 2.84. The minimum age was 27, the maximum age was 45. Then we had around 426 responses, as I said, and most of our respondents were women, female. Okay, so 64.1% were female, rest were male. And we did want to know whether they wanted to work in India or outside India. And I would like to say that around 84% of them wanted to work in India or just wanted to work out of India for a very short period of time. They didn't want to completely shift abroad. Then we had around 358 responses for the question, if you want to work in India, where do you want to work? Do you want to work in do you want to pursue a government job? You want to work in a corporate hospital? Where do you want to do? What do you want to do? So again, we got a response from 358 people, and 36.6% of them said that they wanted to work in a corporate hospital. 23.7% said they wanted to work in a government hospital. Some wanted to, around 11% wanted to work in a semi-private hospital. So based on all these inputs, we included our panelists who were experts in their know some other aspects of sorry about that. Yeah. We wanted to know whether what percentage of people wanted to pursue further academic degrees. So most of them wanted to, around 62.9% wanted to, and around 26.1% were not unsure about it. They just said maybe, and 11% were sure that they didn't want to pursue further courses. So we included experts who actually were from different fields or subspecialties in anesthesia to give their experiences or thoughts about their profession. And there was a little bit we wanted to know about where our young anesthesiologists get their career guidance from. And most of them said that they did not have any kind of career guidance, 63.4%. 36.6% said they did have some career guidance from immediate contacts or mentors. And of course, we asked their opinion on the current information on career guidance, and 36.6% said it was grossly inadequate. 56.4% said it was very inadequate. Somewhat inadequate. So our webinar was born. And we had one more question. We wanted to know what was the probable likely mode that they would like to seek career guidance from. We had, would it be better to organize a full day CME? Would lectures by experts circulated through various formats be good? Or virtual information on a website be good? One-on-one information, would it be better? So most of our respondents said that they wanted one-on-one information. So we tried to cater to all the available modes. We are having a 2-hour webinar today. Of course, it's in the virtual format, but there are lectures from experts, and hopefully you'll be most of our experts will be able to answer your questions one-on-one. Yeah, thank you, sir. Thank you.
Thank you, Dr. Pradeep, for sharing the results of the survey and getting to the point that this is the reason why we all are here today. I just want to remind the attendees to key in their questions in the Q&A section, and I request the panelists to check those questions and answer some of them. Some of the questions are going to get covered in the videos and the Q&A that we are going to have live, but I can see some questions which possibly may not get covered, so I request the panelists to directly answer them on the Q&A section. With this, I think we will start. And before I really get on to the career opportunities, I have a very basic question for Dr. Bala. Sir, do you think that basic anesthesia degree is not enough? Do we need to pursue some course or some degree further?
That's a very pertinent and important question. When any of the postgraduate completes his course, they have to introspect and see what are the gaps all the institutions do not provide all that is available in the specialization of anesthesia, thanks to the resurgence of the technology into anesthesia, like transthoracic echo, transesophageal echo, neuromonitoring, subcortical monitoring, motor evoked potential, spinal cord monitoring, and we have kind of expanded the incorporation of technology into our clinical work, like target controlled infusion, total intravenous anesthesia. So what I personally feel is after you complete your program, you need to assess what are the gaps, which are your strong points and where you have to make yourself better, because skill and knowledge are very crucial for you to foray into doing independent clinical work. So if you think there is a gap, if you have never done much of neuroanesthesia, if you have never done much of pediatric anesthesia, if not been exposed to critical care, now you need to know the gap. So before you jump into your career, into your professional network, you need to choose. So I would personally feel at least a couple of years, everyone have to travel around to garner these expertise and also get mentored by people who have successfully been practicing. So my answer to the question is give 2 more years. Thank you. Thank you, Vibha.
Thank you, sir. So I think most are convinced that they need to do something more. And so let's talk about sub-specialization. And my first question is for Dr. Joseph Mentoro. Sir, do you think there is a need to choose subspecialty, or can we stay generalist? Over to you, sir.
Thank you, Vibha, for that question. I'll answer this in 3 aspects to my answer. Essentially, a structured curriculum with a trained faculty with an exit exam giving you a degree helps students develop, upgrade, upskill to skill sets and core competence with in-depth focused knowledge on the subject. This eventually improves quality of patient care in those subspecialties. The second thing I'll move on to is job opportunities, because this is what the young people ask me. So now, as we all know, a successful business model is one that evolves with time. And we have to keep up to be relevant in the evolving scenario. I passed my MD with a landline, but today it is almost obsolete. So now we've got smartphones and technology has boomed in the past 20 years, 30 years. So it's important to remain relevant in the evolving scenario. And after all, job opportunities are all about supply and demand. So if you train in a niche area and evolve a niche for yourself, then probably you will be able to satisfy that demand in some area which you want. And this also helps us to appoint and to promote students when they apply for a job. When you have got some degree, special needs training, then that helps us. And another thing that's very close to my heart is teaching and training and research and publication. So now we need to train the trainers of the future. So how will they be trainers unless they too undergo the training? Understand? And research and publication is something that India is lagging behind. So you will enhance the quality of publication and research by training for some period of time and obviously improving your career. Thank you. I think, and I would also like to say, life is more about making an impact rather than just making an income. Thank you.
Thank you, sir. That sounded very convincing. But I just want to bring out the other side of the story. And my next question is for Dr. Ranjit. Sir, do you think after you choose a specialization, like you've taken up cardiac anesthesia, does it have any limitations? Is it difficult to go back to the generalist anesthesiologist if required? So,
good evening, one and all. At the outset, I thank Vibha madam and Bala sir and Pradeep sir for this enormous talk of igniting the minds of young anesthesiologists. As I don't know whether to put the word limitation, it is a part and parcel of going into specialization. As you enter into any specialization, your general technique is going to go off. Your spinal epidural, for example, I have not put spine. I can say it proudly, but that is not the right way to deal about it. I will say I have not put spinal for 25 years, but that is not correct. But somehow regional anesthesia is coming back into cardiac anesthesia. So I am getting up to the level of epidural. So that limitation I can over a little bit actually. But coming to the mindset, okay, whenever some patient has a tachycardia, being a cardiac anesthetist, I will think about ischemia rather than thinking about regular light plane of anesthesia pain. That mindset changes. That should not happen. You should think as a normal general anesthetist. That is one point I want to highlight. Another thing is this regular monitoring. See, for example, when a patient is coming for some simple wire removal or sternal rewiring or something, immediately I will go for invasive monitoring. Never think about normal NIBP or pulse oximeter. Immediately I have to go for some invasive monitoring or an advanced monitoring. That affects whenever you go into specialization. Another thing is when you are in specialization, your chance of error should be very, very minimal. You are going to be highly stressed out. I don't know about the regional, but in cardiac, the chance of error is going to be very, very minimal. So you are going to have a long learning curve and long working days to get into minimizing the error a little bit. That is another important thing. I don't know about the pain and other thing, but in cardiac, you have to depend on the surgeon. Okay. Although you work hard, the surgeon will get the credit. That is typical for any specialty, but at least in pain and regional, anesthetists will get the due credit. And another important limitation is we are going to more into imaging modality rather than looking at the clinical aspect. Like Bala sir said, first word he started with an echo. Okay, we always not even see, for example, one patient arrest happened, guy was putting a probe rather than intubating. I scolded him. Okay, but what happened is he diagnosed tension pneumothorax. Okay, I was wrong, he was right. So those things we have to, those imaging modality, rather than looking at the clinical patients, we go more and more into imaging modality. That point is also a slight limiting factor. Those are the things which I want to highlight as a cardiac anesthesiologist.
Sure, thank you. That was a great perspective. So what is the verdict? To specialize or not to specialize? Ranjit sir.
See, I envy Dr. Sunil Pandya sir, like Bala sir said, he did cardiac, neuro, and went into obstetric. So he has like two things. And Shiva Shanmugam sir, he was also trained in cardiac, now practicing regional. So everything they trained in cardiac and gone into another specialization so they can deal the case with confidence. But
sir is hinting towards multiple specialization, and I think we'll go towards it a little later.
Yeah.
So I think the next question that comes to my mind is, what factors should one consider while choosing the subspecialty? And may I ask Dr. TVS Gopal sir for this?
Yeah, thank you, Vibha, for this question. It is fairly important. The first factor would be your personal interest or passion in a particular subspecialty. And since I'm speaking on behalf of Sunil here, I would say it is obstetric anesthesia, I mean, as an example. The second factor would be the prestige that is associated with this subspecialty. I mean, that has to earn some points in favor of the person choosing this particular specialty. And having graduated with honors in this chosen specialty, the third factor would be job opportunities, which would intuitively be more when compared to that with a basic anesthesia degree. And last but not the least, this is very important for all anesthetists, the possibility of further income. So when you have a certain additional specialization in a particular specialty, there is always the thought in one's mind that he or she would be able to earn more when compared to a basic anesthesia degree. So I think in short, these are the factors which would goad one towards choosing a particular subspecialty.
Thank you, sir. Thank you. That was very insightful. I have always wondered about certain specialties where we need to leave mainstream anesthesia, maybe like pain medicine, palliative medicine, even critical care. So my next question is for Dr. Sunita. Ma'am, do you think that I mean, what would be the pros and cons, or maybe better put, the benefits or worries in leaving mainstream anesthesia and choosing a specialization that is quite far away? Ma'am, please. You need to unmute. Sorry. Please unmute yourself.
Thank you, Vibha. Yeah, it was really very difficult to leave anesthesiology and then to enter into a field which was totally different. And when I started, say about 1.5 decades back, that time there were no structured fellowships, no proper programs. We had to do some certificate courses and started. But now, definitely, it is growing leaps and boundaries since last 1 decade. There are structured fellowship programs, well planned for 1 or 2 years in India as well as abroad. So if one plans to go for pain medicine, even our Indian Society for Study of Pain, we have a fellowship program, which is by our academic wing, that is Indian Academy for Pain Medicine, where there are exit exams, there are entry exams, there are proper 1 to 2 years of fellowship courses, and then they have to give an exam and then they get the degree. So this was something which was carried out outside, that is outside India. But now we thought, no, why to go out? Why not to start in India itself? So now we have these programs in India, and I think so most of the young anesthesiologists will get benefit of this. They can contact Indian Society for Study of Pain and they will get this benefit. Apart from that, you can have your independent practice, but then there are a lot of limitations. Like the first and foremost is lack of awareness. That pain clinics exist itself is not known to the community, not known to a common man. So that I'm sorry to say that many of the doctors still are unaware that yes, so many of the interventions can cure and prevent pain if done at a proper time. Even though if we get patients, it is at a very late stage, when the pain becomes really, really chronic and irreversible. So if they come early, I think so definitely we can treat it, because pain medicine is not very simple. It is a steep, there is a very steep learning curve. You have the pain, you have to look at pain from head to toe. So various syndromes, it can be an ENT problem, it can be an obstetric problem, it can be something related to rheumatology. So it is whole body where pain can be there. So definitely you have to learn, you have to diagnose, and even opening a pain clinic is not an easy job, because here you need better communication skills. Here there is direct patient-doctor relation interaction. So therefore, definitely you have to be well versed with the OPD, that setup. And then after that, diagnosing, and then you have to be skilled in diagnosis as well as treating them in pharmacology. So you have to be very good in selecting the drugs which are appropriate for that syndrome or disease. And also you have to be very much skilled in various interventional procedures. And now we all know that you have to update yourself. New and new techniques are coming, new and new interventions are coming. So updating your knowledge is also very, very important. So apart from advantages, there are a lot of limitations also. Investment is very important. Earlier you have to wait, and then once your practice develops, then it is the financial aspect which has to be taken care of. So what I feel in short is, it is your zeal, your compassion towards pain management and towards managing the suffering of a patient, which will definitely take you towards this specialty, that is pain medicine.
Sure, thank you, ma'am. Before we move on further, we have a poll for the attendees. So I request Mr. Venkatraman to put the poll on, and this will help us understand what subspecialty are you doing or want to choose. Could we have the poll on, please? Yeah, please. Yeah.
Is it visible, ma'am?
Yes, it is. Thank you. Please go ahead and answer.
Cardiac and topmost, is it?
It's always the topmost, sir.
So there are 10 options. So please browse down if you are not able to see all the options on the screen. We have got about 220 responses so far. You tell me when to stop.
Excellent. And they're coming in very fast. So I would want to wait till the speed slows down.
I request participants only answer the first question. Second question will come up later.
That's okay, Mr. Venkatraman. I think we can have them because many of them have already answered. I can see 330 people answered the second one too. So yeah, as we start summing up the results, I think most of them are.
Should I stop the poll?
No, I think they're still coming in, but I thought I'll just read out the results. So maximum number of attendees, I see regional anesthesia, and we know the reason why. Also, this next is critical care. Yeah. And regarding the sector that they are working in or want to work in, I see a tie between academic hospital and corporate hospital. And I think this is going to be a fantastic discussion point later. Should we close the poll? I also request each one of you to stop the screen that comes in front of you so that you will be able to watch the videos as we go ahead. So we're going to start videos by the experts now. Is my screen visible?
Yes.
Full screen?
Yeah.
Yeah. So the first video is by Dr. Ranjit on cardiac anesthesia.
Good evening all. I am Dr. Ranjit Karthikeyan, Professor Head of Cardiac Anesthesia in Sri Ramchandra Medical College, Chennai, and I am Founder Director of Raw Online. And what is so unique about cardiac anesthesia? You need a good understanding of a complex anatomy. You have to face deranged physiology, and the pharmacology will be really difficult, and you have to do a vigilant monitoring. And what is more satisfactory is whatever you do, you can clinically apply it and you can see the end result. And here you contribute to cure rather than keeping symptoms at bay. And what is very challenging in a guy who is passionate toward cardiac anesthesia is your ability to think quickly and act methodically under pressure. And the most important flip side of being in cardiac anesthesia is that whatever small decision you do, it has to be perfect. If it is wrong, it might cause lives. And you have some interesting cases like conjoined twin coming in. This patient was posted for a cerebral angiogram. As a cardiac anesthetist, they called us. And here you can see one baby is sleeping peacefully and another one is crying. We were able to anesthetize. Whatever IV you give, it goes into the other child and the other child is anesthetized. And one was not anesthetized. We used inhalation induction in one patient and intravenous induction in the other patient. And coming to the latest innovations in cardiac anesthesia, here you have 3D echocardiogram with strain imaging, and lot of minimally invasive cardiac procedures have come where you can replace the valve or do a off-pump CABG with the thoracotomy. And most important thing is fast tracking the patient and try to extubate the patient in the operating room. And this is not a calendar or anything. This is all advanced hemodynamic monitor. From blood pressure, you can even have your ejection fraction displayed as a numerical value on the monitor. Even lung variables like pulmonary vascular resistance, pulmonary vascular permeability index, PV, PY, everything is being available. Now you have hypotension prediction index also, and we have point of care coagulation testing where what variable is responsible for increased bleeding is available, which prevents the amount of usage of unnecessary blood and blood products. And no more blind technique. You have ultrasound to guide your intravascular placement. Ultrasound is not only used for regional anesthesia but for vascular placement of the cannula, and advanced imaging modalities where you exactly know what is wrong in the cardiac anatomy, and latest advanced devices like LVAD, ECMO are being available. So to conclude, cardiac anesthesia can totally change your perspective as a resident after you finish. Suddenly, all sick and complex patients will be easy to handle. Everybody selects a profession which is close to heart, but in cardiac anesthesia, you are not only close to it, but deal with it. Thank you. Good evening, all. I am.
Okay, so we move on
Respected
to the next one
chairpersons,
on
moderators, and my dear
neuroanesthesia by
students, I
Dr.
have been asked to
Joseph
speak on a
Montero.
career in neuroanesthesia. One day, Alice came to a fork in the road and saw a Cheshire cat in the tree. Which road do I take? She asked. Where do you want to go? Was the response. I don't know, Alice answered. Then said the cat, it doesn't matter. Let's begin with an NCQ. Are you looking for a dynamic and rapidly advancing subspecialty where your anesthetic technique can have a real impact on both operative conditions and patient outcome, where advanced airway skills, multimodal monitoring, and management of challenging and complex cases are required on a regular basis? Do you enjoy bringing physiology and pharmacology to life while working as a part of a dedicated team while managing critically ill patients? All of the above. If your answer is all of the above, neuroanesthesia and neurocritical care may be the career choice for you. As Rabindranath Tagore said, you can never cross the ocean unless you have the courage to lose sight of the shore. Keeping these in mind, when you pass off your MD or DNB anesthesia, you're always in a quandary whether you should further subspecialize or continue into your practice. At this stage, it is best to think carefully before you embark on your future career. Keeping these thoughts in mind, when I was already being appointed a consultant in Hinduja Hospital, Bombay, I took a break and went off to Cambridge in 1997 to 1998 and worked at Attendee Hospital, Cambridge, and did a career in neuroanesthesia and neurocritical care when neuroanesthesia and neurocritical care had not yet started structurally in India. May your choices reflect your hopes and not your fears, as Nelson Mandela, another inspirational leader, has said. The Japanese have a very good concept of ikigai, where you can combine passion, mission, vocation, and profession into something that can empower you to work successfully in your life. And my colleagues all over the country have written an excellent article, Choosing Neuroanesthesia as a Career, Marching Towards New Horizons. This is published in the Indian Journal of Anesthesia. One can go through this article and have a better insight into whether you should take a career in neuroanesthesia or not. These are the various courses available to you, DM 3 years, DRNB 3 years, and fellowship programs of 1 and 2 years. I started off with a fellowship program in neuroanesthesia in Hinduja Hospital, which I ran for about 6 or 7 years. And then now we have converted it to a DNB neuroanesthesia program for the past 4 years. We all make our choices, but in the end, our choices make us. These are the happy faces of my neuroanesthesia fellows who have trained with me and are now successful consultants all over the country and abroad. These are the images of my students in DRNB neuroanesthesia. 3 of them are currently still pursuing it. The other 2 have passed. Go the extra mile. It is never crowded. A winner is a dreamer who never gives up.
Thank you, sir. Due to some unavoidable reasons, Dr. Sunil Pandya could not join us, but we have a video that he has sent us on obstetric anesthesia.
Dear friends, the future after doing your MD or DNB anesthesia is brilliant and the demand is ever increasing. Well, before I go into the details, I'll take you through my own journey. Post MD, from Osmania Medical College, my dream was to work in a busy private hospital with a high-end infrastructure. And following that, I wanted to do the highest degree in anesthesia. And I joined PDCC at Sri Chitra Children's Institute in cardiac and neuroanesthesia. And fortunately, we formed a team in Jan 1997, and we started a team practice with a focus in onco anesthesia and obstetric anesthesia. We also started a 6-bedded surgical intensive care unit. I was not a very keen OB anesthetist, but as a team, we were sort of compelled to go to Obstetric Center, Fernandez Hospital. And reluctantly, I started going there. But in just 1 month's time, I took a deep plunge because I started enjoying it. Anesthesia for high-risk obstetrics, the labor anesthesia, the obstetric critical care. We brought smiles to several young women. That was very, very rewarding and very gratifying. So it was no looking back. We started a dedicated obstetric critical care unit, set up protocols, started implementing. So today, if I look back, having done cardiac anesthesia, having worked in ICU, and having met several of my colleagues and friends from different subspecialties, cardiac, neuro, critical care, pain, and other things, I feel obstetric anesthesia is one specialty which embraces all the other subspecialties. like regional anesthesia, pain medicine, difficult airway, critical care, and importantly, it always keeps you on your toes. Indeed, an experienced anesthesiologist, tomorrow, if you want to migrate to any other subspecialty of anesthesia, you can migrate with ease because already you have been exposed to the challenging and most demanding circumstances. This specialty is a unique specialty because this is the only specialty where we contribute to the society and the nation also by minimizing or helping to minimize the maternal mortality ratio. And importantly, we also prevent or minimize orphans being born, which is very gratifying, and the feeling cannot be measured or cannot be measured on any metrics. Importantly, the specialty of obstetric anesthesia is ever growing and the demand is not going to come down because we know that this is evergreen specialty. Bottom line, listen to your heart, listen to what your mind says, and do what is your passion. And I wish you all the best in your future endeavor. Thank you, Dr. Bala Venkat. Thank you, Dr. Viva, for giving me this opportunity, and more on this during the discussion. Thank you very much.
So now moving on to
Dear friends.
anesthesia for tiny tots. And for this, we have Dr. Nandini Dave with us. So here's her message.
Anesthetists have lagged behind our surgical counterparts with regards to specialization. We continue to be the jack of all trades and master of none for decades. To give you a sense of perspective, pediatric surgery became a specialty in the 1960s, whereas we started formal training in pediatric anesthesia only in the 2000s, 40 years after our surgical colleagues. So what is a skill set you would need to be a pediatric anesthetist? Again, this is required of every physician, but a pediatric anesthetist only more so. 1, knowledge and skills, but also gentleness, dexterity, and finesse. 2, very good communication skills. You don't just treat a child, you manage a family. 3, a penchant for paying attention to the small things, preoperative fasting, IV line fixation, weight-based drug dosages, etc. 4, flexibility, adaptability, and finesse. Be sensitive to what the child and the family want. An anesthetic without fear or pain. Be prepared for last-minute changes to plan. The child who said okay to the IV line now doesn't want the needle. What is the downside? There's not much money here. Unlike adults who would have medical insurance, most children's surgeries would come in a budget. It would not matter if you're in a fixed income job, for example, in a medical college or a public sector hospital with salaries according to seniority, but in the private sector, your earnings would have a ceiling. Make no mistake, you would surely earn enough to make a decent living, but no comparison to cash-rich surgeries like joint replacements, cardiac surgery, etc. The risks are perceivably higher. Smaller patients, reduced margin of safety, but this again is debatable. The upside, children are a joy to work with. So if you like being around kids, this is your branch. The comorbidities in the past history is much less. No diabetes, no hypertension, ischemic heart disease. Depending on where you work, there is a wide spectrum of cases. For example, pediatric neurosurgery, orthopedics, plastic surgery, so never a dull moment. If you are a regional enthusiast, all the blocks in kids can be very satisfactorily performed in kids. We are a young country, so the patient base is really large. And there are not many qualified pediatric anesthetists, so the opportunity is huge. It helps as you grow older. Parents see you as someone motherly, grandmotherly, very capable to take care of their child. Maybe a way to decide would be to do an observership, shadow a mentor, or even consider fellowship. It may seem a lot at that time, but it's really a very small investment in the grand scheme of your entire career spanning about 40 years. If you later decide to be a generalist, your pediatric anesthesia skills will stand you in good stead. Or it may be the year that charted the course of the rest of your career path. It's said that you choose a job you love and you'll never have to work a single day of your life. So choose wisely and choose well. Best wishes to you, the future generation of anesthetists.
Thank you, Dr. Nandini. Moving on from a specialty that's close to my heart to another one that I'm passionate about. And this one is onco-anesthesia. And we have Dr. Jyotsna Goswami sharing her message with us.
Good morning. At the outset, I'd like to thank the organizers for giving me opportunity to talk about onco-anesthesia, which is a relatively new subspecialty. As we all know, that the incidence of cancer is increasing worldwide and more so in the developing countries like India. The Lancet Commission on Global Cancer Surgery has estimated that by the year 2030, about 17 million surgeries will be needed each year. And these are prolonged complex surgeries being performed on patients whose health has been already compromised by the disease itself or by the side effect of anti-cancer therapy. Therefore, a dedicated workforce is the need of the hour, including specialty trained anesthesiologists who are well versed with these complex issues. The anesthesiologists are the backbone of such dedicated surgical team, where they function as a complete perioperative physician, from thorough preoperative assessment, rehabilitation including treatment of anemia, malnutrition and other comorbidities, to delivering impeccable perioperative care so that the patient can resume their planned cancer treatment on time. As onco-anesthesiologists, we have the unique distinction of not being limited to any one anatomical location. Surgery for cancer in each area has its own set of challenges which we need to handle. Additionally, recent evidences showed that the anesthetic technique and the drugs may influence cancer outcome in terms of metastasis and recurrence. We need to develop the expertise in advanced anesthesia skills of airway management, regional anesthesia, point of care ultrasound, cardiac output monitoring, etc. Thus, the specialty of onco-anesthesia will empower you to become a clinician that is future ready with knowledge and skills that command respect from both your colleague and patients. With large cancer centers coming up across the country in private as well as the public sector, the employment opportunities of onco-anesthesia are immense and secure. There are certain flip sides as well. Many of these oncosurgeries are of long duration that demands long, stressful working hours. Also, this is the only specialty where we see many patients dying of cancer. The agony of the patients and their family, what we face in our daily practice, can be emotionally challenging for us. But it gives us a sense of fulfillment when we can make them comfortable. To sum up, onco-anesthesia provides exposure to all facets of advanced anesthesia practice, research, academics, and numerous opportunities of institutional employment. Thank you.
And now on palliative care medicine by Dr. Anjum Jod. I already saw a few questions in the Q&A regarding this. So please listen to this carefully.
I'm here today to take you through the strengths, weaknesses, opportunities, and threats of an anesthesiologist thinking of taking up a career in palliative care medicine. So as anesthesiologists, we are skilled in managing pain. We are familiar with the analgesics, with the pain pathway, and we are very good with physiology. So it really helps us when you're handling symptom burden and treating pain in the symptoms in the patients who need palliative care. Also, our expertise with needles and with the USG probe will help us in interventions for pain management and for symptom control, for example, diagnosis and treatment of ascites and pleural effusion, where we could be skilled in doing a paracentesis or pleural effusion. We would need to, however, after our MD or DNB in MD anesthesia, do a year's training in a good institute with the palliative care exposure to feel confident and competent in treating patients with palliative care needs. Opportunities. For people working in cancer hospitals, you will see the symptom burden is huge in advanced cancer, and we can do real rewarding and good work there. Also, for people who have a major contribution in ICUs, you know that a significant proportion of patients in ICUs are planned for comfort care or for DNR, and there we can achieve a good death. We can help prevent inappropriate life-sustaining treatment and help a lot of patients and families, especially considering the high cost of ICU care, which is mostly out of pocket. Now, when we come to weaknesses and threats, in palliative care, we see a lot of death, we see a lot of suffering. So that is one thing that we need to be prepared to handle. The other thing is we need to be really skilled in communication. We need to listen to our patients and their families. In threats, we know that in 2012, the NMC recognized MD in palliative medicine, and in 2020, the National Board of Examinations recognized the DNB in palliative medicine. So while most hospitals, most corporates, trust hospitals, even government hospitals today are accepting anesthesiologists with adequate training in palliative care medicine for faculty posts, for academic posts, and as consultants in palliative care, some institutes like AIMS and the Tata chain, like the Homi Bhabha across the country, they are only keeping an eligibility criteria of MD palliative medicine or DNB palliative medicine for a faculty post.
Right. Thank you, Dr. Anjum. And now we move on
Good
to
evening.
another specialty, and that is critical care, for which we have Dr. Sheila. I already heard some.
Good evening, friends. I'm Sheila Mitra, Professor of Anesthesiology and Critical Care, working at the Tata Memorial Hospital in Mumbai. I'm also the president of the Indian Society of Critical Care Medicine. The DM Critical Care program first came to Tata Memorial Hospital, and I'm really fortunate to be the teacher of the first student who passed DM Critical Care in the country. I have about 25 years experience practicing critical care, and today I'd like to share with you my perspective on training in critical care and taking up critical care as a career. Now, I think the COVID pandemic has shown us the strengths of an anesthesiologist working as an intensivist. We're really good at resuscitation, we're good at procedures, we're very good at maintaining the cardiorespiratory status. But having said that, critical care is beyond initial resuscitation. We also have to make a diagnosis and manage the patient subsequently. And this is one area we're not very strong at, and we need to learn further. For example, diagnosing a pneumonia or prescribing antibiotics is not part of our anesthesia training. Now, critical care as a specialty was recognized by the then Medical Council less than 10 years back. I have 25 years experience practicing critical care, but I don't even have a degree. So we're really fortunate now because you have degrees, you have DM critical care, you have the DNB, you have courses that are run by societies like ISCCM, you have IDCCM, IFCCM, you also have the PDCC that is run by several universities. So you can get a qualification after doing your anesthesia training. Now, there are advantages of doing critical care. It's a really rewarding specialty. I can say that because you're there through the entire patient journey in the intensive care unit. You're not just confined to the operating room, giving an anesthetic to the patient. You're there right from the initial resuscitation to making a diagnosis, to managing the condition, treating the patient, getting him better. So you get a lot of respect and blessings from the family as patients get well. You're also not dealing just with surgeons, but other specialties across the hospital, and often you are the nodal point connecting between various departments in the hospitals. Financially also, it's a very rewarding specialty, and it's a really new and upcoming specialty, and I see it growing every day. More and more ICUs in hospitals, more and more ICU beds, and more demand for the intensivist care as we're going forward. And I'm seeing things that we never saw before. Today as an anesthesiologist intensivist, we can admit patients under our name. We also can have an OPD, a post-discharge. We look after the ICU patients, and we can see them in the OPD as a follow-up. So these are all new things. It's a dynamic specialty, but of course there's a downside. There's significant burnout, long working hours, night duties, but these are things we need to work around. Again, depending upon the type of ICU that you're working in, if it's an open ICU, sometimes, you have the primary specialty admitting the patients, and you have to take orders from them, and you also have to coordinate between other specialties. So that can be a bit frustrating, but you can choose the way you want to work. You can do full-time, part-time intensive care. You can be part of, a group practicing, that is a group practice where you might be covering certain ICUs, or you can even do a freelance as an intensivist. So a lot of options available. So in summary, I'd like to say that if you like medicine, if you like resuscitation, diagnosing a patient, and being through the entire patient journey and dealing with patients, their families, and also other specialties, then critical care is a specialty for you. Thank you.
Thank you, ma'am. Our next video is on pain practice by Dr. Sunita.
Greetings from Orange City, Nagpur. I'm Dr. Sunita Lavange, consultant pain physician, and I'm practicing pain since last 1.5 decades, and I'm director of Ashwini Pain and Spine Center at Nagpur. Today, I'll be sharing my thoughts regarding choosing pain medicine as career option after post-graduation in anesthesiology. Anesthesiologists are the ones who have expertise in managing pre-op, peri-op and post-op pain. They are well versed and comfortable in OT premises. They have in-depth knowledge of drugs, equipment, and also in handling emergencies. And this is an added advantage when it comes to select pain medicine as a career. As a specialist, pain physician deals with chronic pain, its management. For this in-depth knowledge, pathophysiology of pain, the pain various pathways, it's the pharmacology of drugs, as well as skill in performing interventional pain procedures has to be attained. And for this, one has to get trained under various fellowship programs or certificate courses which are running successfully since last many years in India as well as abroad. Recently, DM and F&B pain medicine has also been started, and hence pain medicine is recognized as super specialty nowadays. It is a very rewarding and satisfying branch because one treats patient suffering, so you are going to get a lot of gratitude and blessings from patient's side. You can become financially independent, can have your own setup, as well as there is a direct patient-doctor interaction and a long-term association with patient and his family, which is often lacking when we are working as anesthesiologists. Apart from that, you can have a perfect balance between work and life, as there are no odd hours of working and emergencies. So quality time can be spent along with your family and friends. Apart from that, there are various challenges also which one must be aware. In-depth knowledge is very important, communication skills, also investment if you are starting your own setup. Otherwise, you can start OPD base. You can start on OPD basis, or you can get attached to various corporate hospitals as visiting consultant, or you can get attached to various as pain physician to various multi-speciality hospitals, so on sharing basis. Pain medicine is growing leaps and bounds. For this, we need more and more pain physicians in forthcoming years. WHO has rightly said that pain is a silent epidemic of 21st century, and to tackle this, more and more trained pain physicians should come forward and say choose this branch which is definitely going to flourish in forthcoming years. Thank you so much. Greetings from our institute.
Sorry. So the next
Hi
video
friends,
is on
I am
regional
Dr. Suresh
anesthesia.
Shanmugam, Professor working at Department of Anesthesiology at Mahatma Gandhi Medical College and Research Institute. So I am here today to share my experience, life experience in the journey of regional anesthesia. I try to express myself in the answers for 3 questions that Dr. Vibha asked me to talk about. The first one is, how about choosing this career? Is it exciting? Actually, I have not chosen this career, but my life puts me into these situations. Basically, I am a cardiac anesthetist by training. Because of my cardiac work is limited in the institute, I used to spend most of time in the non-cardiac cases. And I do a limited private practice, which is an exclusive orthopedic unit. That's a busy unit. So in about a 3 to 4 hours time, we do 4 to 6 cases. For example, the yesterday list was a 4-year-old toddler has a femur tensionite to be removed. That's the first case. And then the second case, a 40-year-old man with comminuted clavicle fracture with multiple rib fractures as well. And the third case is a 90-year-old man with proximal humerus fracture shoulder, and he's dementic. He's a known case of Parkinsonism. Not only that, I have 2 OPD cases which has got a shoulder mobilization and a knee stiffness. Both are having an extensive comorbidities. So I have been pushed like this on an extreme that I need a regional technique that works consistent, predictable, no nausea, vomiting, no sedation, straight fit cognition, because most of these patients are getting discharged on the same day. To make it more predictable and precise, I use an ultrasound. So I have been not only forced on the patient care domain, but I need to do a lot of research to explore how things works. Then only I can meet all these demands set by life. After knowing all these things over a period of years, I want to teach to everybody. So we have a training system in our institute, ranging from 15 days observership to 1 year exclusive ultrasound guided regional anesthesia fellowship. So in all these 3 dimensions, in terms of patient care, teaching, training, and research, the life of regional anesthesia engages me to the core. So question number 2, what it takes or what are all the limitations of choosing this career? I will not say it's a limitation. I would say what it takes. Definitely it has got two components. One is you need a competence that you need to build up, which is going to take your time and energy. I will talk about it in the question and answer session. And second thing is there is an investment involved. So I have two suggestions. One is whichever the specialty you take this ultrasound skill with you. And number 2, whichever the situations you are put in or wherever you are, you ensure that whatever you are offering to the situation is more than what you are receiving from it. So all the time be in a state of offering than be a beggar. Everything will fall in place. Best of luck for your bright future. Thank you very much.
Thank you. So we've heard them all. And what really bothers me is that, which also came up as a question, is that what should one pursue when they select a specialty? Should it be a university or a society recognized fellowship course? Should it be an FNB or should it be a DNB? And I'm going to ask Dr. Nandini to answer this question for us.
Okay. Yeah, thanks, Vibha. So I can speak for pediatric anesthesia, but also several other branches which we have heard all the experts speak. So you have a fellowship course, which may be 1 year, 2 years. You have the DM course, which is a 3-year course, and something in between, which the DNB has now introduced in pediatric anesthesia, transplant anesthesia, onco anesthesia, and several other branches, critical care much early on, is the FNB course. So the 2-year, typical 2-year courses, So how do you choose between something which is 1 year, 2 year, 3 years? That's what, a lot of students do ask me that. I would think just as a general guide, suppose you're not sure, a student is not quite sure of what he or she wants to do in the future, or it may be that he's not been exposed to that during his MD or DNB. For example, the institute where you worked didn't have, say, enough obstetrics or enough pediatric anesthesia, then to test the waters, to see how it, whether you would like that branch or to gain more from that branch, you would best do a fellowship, in my opinion. On the other hand, I have had students who are extremely sure. They know that this is what they want to do and nothing else. DM is the way to go. My first DM student, she waited for 1 year because the DM course had not started in the country. And she let go the first super specialty exam. She had cleared it. Pediatric anesthesia had not started. She waited 1 year and took the NEET exam, second year time, and then joined the DM in pediatric anesthesia. So if you're that focused, then DM is the way to go because it's a life-changing thing. It is, you've chosen that career. Then really speaking, there is no turning back. Recently, what DNB has done is they've also introduced their FNB in pediatric anesthesia, and I believe in many other branches, it's already there. So that's a 2-year course. So that's something in between. But I think the appeal of the DNB is that it's pan-India. And also there are several hospitals who are accredited. In contrast, for example, DM pediatric anesthesia, it's only there in KM Hospital and PGI Chandigarh. The FNB in pediatric anesthesia is available at about 6 or 8 hospitals already. So the opportunities are more, and it is a 2-year course compared to a 3-year course. So I think this is one way to kind of choose what you would, what course you would want to do. Dr. Bala is saying something.
Dr. Bala, do you want to add something?
No. I think you can continue.
Okay.
Yeah.
So that's what I feel, Vibha. Does it answer your question?
Yeah, of course. A lot of clarity on what to choose based on what they are looking at and wanting to do. Thank you. But then I'm wondering that those who choose to do shorter fellowships, and this question I would want to ask Dr. Sheila, because there are shorter courses for critical care as well as DM critical care. So what do you think, when do they get ready to start independently practicing after they have finished a shorter, say, fellowship course?
Thank you very much, Vibha. I think this is a very relevant question, and it's a question I'm often asked. So I don't think there is any correct answer when you can say you are, absolutely ready, because one never stops learning, and it's always, continuous process. But having said that, most of our courses are anywhere between 1 to 3 years. And a 3-year curriculum sort of makes you quite well-rounded because these are very structured now, the critical care courses, and they have, a structured curriculum based on certain competencies that are required. However, having said that, it really depends upon where you are training. So there could be a high volume center where you might acquire the knowledge, the skills, and what you need to do in a very short period of time. It also depends on who you're training under and who is you're mentoring in. And of course, the individual as well as to how fast they are able to grasp the subject. But, 3 years, I think, has been determined with a purpose. So it really doesn't, we don't have enough DM seats in the country. And a good thing that has happened is that the FNB, which was there earlier, which was a 2-year course, has now been converted to the 3-year course in most specialties. And I think that's good because even though everyone cannot get a DM in critical care, of course, I'm speaking from a critical care perspective, at least you can do the DNB, which is an equivalent. And even those going overseas, the 3 years is considered as an equivalent, like a super specialty training as you would have with MCH or any other courses for following surgery. So this is really good because we have a lot of DNB seats in the country. But I would not taking anything away from the 1-year courses, the PDCC, the IDCCMs, the IFCCMs, because these are conducted in some of the institutes where you have the most experienced intensivists and some of the best centers. So here, even though it's a 1-year curriculum, the students get a very, very good experience. So I think, it really depends on the individual. So many teaching institutes prefer to have someone who's DM qualified and, they want to attract them. But even if you do, say, an IDCCM, if you can do subsequent 1 or 2 years of training, I think by then you will be quite well-rounded and reasonably experienced, though as I've said, the learning never stops and it's an ongoing process.
Oh, thank you. Thank you for adding perspective on this. I was wanting to ask a question to Dr. Jyotsna. Is she around, Dr. Jyotsna? Ma'am, are you there?
Yes, I'm there.
Yeah. Ma'am, good evening. So do you think that doing fellowships and additional degrees, they add value? Oh, did we just lose her?
No, I'm there.
Yeah. Sorry. I think someone,
If I get disconnected, then please take it up.
Yeah, sure. So do they add value to career advancement? What do you think, ma'am?
Yes, thank you, Viva, for the question. As Dr. Balavenkat mentioned in the beginning, that each specialty needs some additional knowledge and training and skills for advancement. So such in onco anesthesia also, it provides extra knowledge, extra skills, which we need to treat the cancer patient. And that to cater, to cater this increasing cancer caseload, many cancer hospitals are coming up across the country, and both as a dedicated cancer center or as a part of a multi-specialty hospital, also as the private and government sector. So all these setups, they need a specialist anesthesiologist. So the job opportunity as an onco anesthesiologist is immense. Also, these hospitals, I would say, pay reasonably well for this specialist service, and which can make the students there, the youngsters, I think, financially quite comfortable. And if you look at the job satisfaction, as onco anesthesiologist is an important member of the perioperative care team of a cancer patient. So right from the time from the diagnosis to the treatment, anesthesia service is needed almost everywhere, because such as various investigative procedures under anesthesia, insertion of long-term venous catheter for the treatment like radiotherapies in pediatric patient, then pain management of chronic cancer patient, in addition to our perioperative management of the oncosurgical patient. So there is an immense recognition of an onco anesthesiologist in the institution, and this recognition gives you a good job satisfaction.
Sure. Thank you, ma'am.
Okay. So I will say I saw some questions actually in the question and answers.
Maybe you can type them, ma'am. Would it be okay if you type the questions? Because we are running slightly behind schedule.
Yes,
Thank you so much,
we'll
ma'am.
do that. Thank you.
So yes, maybe the fellowships and degrees are useful when it comes to career advancement, but what if? My next question is Dr. Shiv Shanmugam, sir, and I want to ask him that in the absence of formal training, like I saw a few questions in the Q&A box, is there a way to develop some of these skill sets?
Yeah, thank you, Dr. Vibha. As you said, the one-year fellowship program is too long for many of the graduates. So now in AORA, we are trying to provide at least 3 services. One is a 15 days observership, which is actually only an observership. There may not be any hands-on skill, but that will give you a good insight to people who are willing to look at or gain those skills. And then we are looking at some hybrid kind of a course where it extends from 3 to 5 months, where it offers some amount of hands-on training as well as theory knowledge buildup. And those who wanted to grow in that path, then 1-year fellowship is available. So as of now, to upgrade this regional anesthesia skill, we have a 15 days observership and a hybrid course, which is extending from 3 to 5 months and 1-year fellowship program. Similarly, these sort of short-term training courses, like for POCUS, if somebody wants, it's available. Like somebody wants to get trained in a transthoracic echo, it is available. So most of the conferences now they are conducting for short-term skill upgradations. They can attend the conferences. If they wanted to proceed and pursue a lengthier period of time, these are all the options available in terms of regional anesthesia.
Sure, thank you. Thank you so much, sir. We now switch gears and move on to the place of work. And for this, we have Dr. Bala Bhaskar, sir, talking about academics.
Nice speaking to all of you, the youngsters. I have been working in a government medical college for more than 30 years now. More than 200 degrees have passed out, and it's exponentially increasing across the country in terms of the numbers. So more numbers, there is a lot of confusion. So, but one thing I would like to say before proceeding further is basically have a self-assessment, each one of you, and pursue what your heart says, not the mind. In fact, if you do so, the future is always there for you to expose your potential. Maybe it could be a 2 or 3 or 4 years late, but then you'll really be a successful anesthesiologist. And in fact, if you're talking about the academics and as an academician in a government medical college, there are definitely some advantages as compared to other setups. But only limitation is in the modern world, you should be able to get into the government system because of a lot of constraints which are there already. And you can in fact pursue some research. So all of you have some experience of research as PTs. You can accelerate your academic career and also your interests by submitting articles to the various journals and doing more and more research. In fact, I remember when I was editor of IJA, there were at least few of the youngsters whose quality of the research was very good, but manuscripts were not that good. So I would encourage them, some of them would respond with more than 20 revisions. Okay? And in fact, after that, they became seasoned submitters and their articles were frequently published. And there are people to notice you, like they have something like Ganga platform where Dr. Bala has given scope for many youngsters. And government also is very liberal for you to go to various programs. In fact, we have got almost 25 to 30 days of special casual use in many government institutions. It's like you have to adapt to the government system. It's like horses for the courses. You can remain a horse, but you can adapt to the government system, and there is a great career for you ahead. In fact, government has got more money to spend on health and medical education training nowadays. More and more advanced devices and technologies are also shared with the government systems. And you can also be part of the administrative gang. In fact, you can have, as anesthesiologists, you can have special skills as a leader. And in fact, you can go further up the ladder. You can also go to the university level. You are better heard. You can also go to the level of the National Medical Council. So there are certain advantages. This can definitely be realized in a government setup. Only thing is you have to work with the peers and the bosses, make it a team movement and team effort. Definitely it will work in the long term. In fact, I can say somebody like me, we have got a lot of options because we are seniors and so-called big people, but we don't have much liberties because we are constrained with a lot of responsibilities. You as a beginner, you have got both a lot of options and a lot of liberties. Please take it up. Any doubts, we are there to clear up during this program. All the best.
Thank you, sir. We now
Greetings,
move
all.
on to the next
Nice.
video on freelancing. And this is by Dr. Pankaj Gupta, sir.
Good evening, dear friends. Greetings from the holy city of Nasik, where I've been practicing for the last 33 years. I feel private practice has a lot of challenges. Every OT and every city has a different brand of practice. And I feel it's for each one of us to set our own standards and decide in what sort of way they want to go ahead and succeed in life. Knowing your limitations is very important. Learning to say no early in your practice will help a long way in working with the right type of surgeons. Don't compromise on the life of any patient whom you are giving anesthesia. Be a perioperative physician. Visit the patient preoperatively. Have a proper PAC counseling. Postoperatively also, it's very important to visit the patient from the pain management point of view or the IV fluid management. Make the surgeon so dependent on you that he waits for you and decides to keep his cases according to your availability. This definitely happens after a few years of struggle that all of us have to go through. Today, I work with about 4 surgeons, all super specialists, and believe me, I'm extremely happy in my setups. So I feel it's for each one of us to decide what level of practice they want to do and how they go about doing it. Time management is very important. Keep proper time between 2 cases. I feel calculate the travel time because that is also important in bigger cities these days. Always talk to the relatives before and after the surgery. Never leave a patient in between, like which is happening in today's world. I hear from so many corners of the country that people give spinal and within half an hour they go for the next case. Please, please do not do that. It is very harmful to you and very harmful even to our reputation as an anesthetist. That is one major reason why many people say that they are not getting an increase in remuneration, which I feel is very pitiable in many parts of the country. I feel by doing a proper private practice, dedicated work, maybe doing 2 or 3 or even 4 cases in a day, you earn as much as your colleague who works in a corporate setup earns by working maybe almost 3 or 4 times the time that you are spending with your patients. So I feel private practice has a long way to go. Be happy as private practice, lay your own standards, lay your own rules, be happy in life because after all, this is just one life that we get. So I feel I would like to conclude here by saying thank you to the organizers for considering me worthwhile talking among these illustrious speakers that we are having even after me and before me. At the same time, the discussions can continue anytime, even after this webinar gets over. Thank you. Thanks a lot.
Thank you, sir, for offering to answer the
friends.
questions even later.
Greetings from the holy city
We
of
have our
Nasik.
next video by Dr. TVS Gopal on practice in corporate hospitals and group practice.
Good evening to all. Thanks to Vibha for her initiative, which I believe will be an eye-opener for young budding anesthesiologists. As a proponent of group practice for over 2 decades, I chose to select we over me. The traditional options for practice for an anesthetist in India include solo practice and academic settings. That said, group practice is an emerged trend in India with several groups in operation across the breadth and length of this country. Typically, group entities could be loose aggregates or partnership firms or professional corporations such as ours. The question we need to ask ourselves is, why group practice? In today's world of corporate practice, we anesthetists are rendering anesthesia as a business to customers that include patients, surgeons, hospitals, and payers, each of whom have their own set of expectations from the anesthetic department. Therefore, in today's medical marketplace, the impetus is on cost reduction, quality improvement, patient safety, our performance is measured on a daily basis, and we are expected to be up to date with technological innovations. In this scenario, the anesthesia group must perform as agents of change while upholding patient safety, ensuring clinical outcomes, ensuring the delivery of quality care while remaining within the ambit of sustainable finances. And this is a tightrope walk that we walk each day. As far as a young anesthetist is concerned, the concerns with group practice would relate to sharing of work time and income distribution. Believe me when I say this, there are time-tested modules that address these issues by ensuring equity and parity with the above. On the other hand, the unquestionable benefits of group practice include regulated work hours, the ability to combine interests and talents, the pleasure of having peer consultation in case of difficulty, which means that we are sharing risk by adopting a collaborative approach. In conclusion, it is only teamwork that makes the dream work. Thank you.
Thank you, sir. We now move on to our next video, and that is by Dr. Manivannan on becoming an entrepreneur.
I'm Dr. Manivannan, founder, managing director of Kaveri Group of Hospitals. I finished my MBBS from Madras Medical College and then finished my post-graduation in anesthesia from BJ Medical College, Pune, and came down to my native town, Trichy, and started our own hospital. I'm an accidental entrepreneur. I didn't have any idea. We are first-generation doctors and entrepreneurs. In fact, after finishing my post-graduation from anesthesia, I came back to Trichy. And then at that point of time, a group of friends were about to start a hospital. So along with them, we started the hospital with 30 beds. Why 30 beds is because we didn't have money beyond 30 beds. And over a period of time, we have grown to now 1,500 bed hospitals, more than 10 hospitals in 6 cities across Tamil Nadu and Bangalore. In the next few years, we are going to add 5 more hospitals. We'll be a 2,000 crore turnover company. Yes, anyone can become an entrepreneur. Entrepreneur is not something which is in your genetic makeup. I feel that every doctor is an entrepreneur. In India, if you take any professional group, doctors are the group which has got most number of entrepreneurs. If you take engineers, most of them work for some big companies. Whereas doctors, most of them will start their own small clinic or small hospitals. That could be 30-bedded hospital or 100-bedded hospital. Or they could work in big institutions, start their own department and build a department. That I call an intrapreneur, not an entrepreneur. So every doctor has got an entrepreneurial mindset. Anesthesiologist traditionally has been a back-end job. They have been helping the surgical colleagues to give a good outcome to the patients, and they have been doing a great job. But in that journey, most of the time, the anesthetist gets frustrated that because of their back-end job, they don't come into the limelight. They come into the limelight only when there is some mistake comes. When good things happens, they generally are not appreciated or recognized by the institutions or the team members. And because of this lack of recognition and public visibility, what happens during the end stage of their career, sometimes anesthetists are replaced by a younger anesthetist and they don't have an option because they don't have a clients of their own, actually. To overcome this, anesthetists should plan to take some front-end jobs. And entrepreneurship is one of those things, actually. If they take entrepreneurship, probably they are part of the institution build-up and the institution will take care of them at the end of the years. Anesthetists becoming an entrepreneur, there are multiple options. For example, when I've started this hospital along with my founder, managing director of Kaveri Group of Hospital, I've also started an exhibition company called Medical. It deals with medical equipment exhibition. It's India's leading medical equipment exhibition. Last 18 years I'm doing it. And I also started a software company called Agile Health. I'm the founder director of the Agile Health, which deals with hospital ERP systems. An entrepreneur is one who finds a problem in the society and finds a solution towards it, actually. Entrepreneurs for anesthesia, entrepreneurship for anesthesia could be in various ways actually. Okay, it could start a hospital or an exhibition like me or a software company, but most of the time the anesthetists start hospitals, run and manage hospitals, chain of hospitals, a diagnostic center, or they could start, I've seen doctor anesthetists running a training center, and I've seen anesthetists running a naturopathy center, and I've seen anesthetists who become NABH assessor and the quality champions. They train a lot of people, they run consultancy services. Like that, you can start other allied medical businesses like a laboratory or pharmaceutical supply chain, and so many other ways you can do. When opportunities are immense, you need to explore it in your own area, depending upon your resources available.
So I think most of the work areas are very well covered by the experts. And I have a few questions though. And my first question is to Dr. Balabhaskar, sir. So what do you think of financial security in government or academic institutes vis-a-vis corporate or freelancing practice?
I feel, when you talk about financial security, it's not just the money aspect, but mainly the job security that goes with a government job. In fact, all our elders, the parents would always say got a nice job security in government, not in other setups basically. But I would want to go beyond that also, not just job security. There could be possibly a better work-life balance in a government job long term, not short term. Youngsters, either it is corporate setup or a non-academic setup, anywhere, they are expected to put in more hours of work in the early hours of their career in any place. In fact, in the QA box, I saw somebody talking about a very difficult working condition in hospitals, in teaching hospitals, government institutions, something like that. But that's a time that you expect youngsters to put in more efforts and learn more. So that should not be a complaint. And our friends in the corporate setup also, many of are here also today. I think they put in more hours of work than otherwise. For example, I at my level would put in. But long term, there is a greater income, basically. But job security wise and work-life balance wise, it is slightly disadvantageous to our colleagues in the corporate setup. And when you talk about the academic institutions and government setups, something like central government aims and other setups, there is some pay disparity as compared to the state governments. But the plus point is majority of the state government institutions permit private practice for us as anesthesiologists. So in fact, that will add to an additional source of income for majority of anesthesiologists in the state government sector. So this also brings up some financial parity. So at the end of the day, it's not that, that's why I said it's not financial per se. It's a matter of getting mental satisfaction and work-life balance. And one additional benefit you may have in government setup is we'll have post-retirement benefits. So that facility and option is generally not available in the corporate setup. You are at the mercy of the management, which is becoming less friendly to doctors overall in the modern world. And again, this is a relative thing, basically, working in government or a corporate in academic area or whatever. And if somebody is not interested per se in private practice also, I think we have the pleasure in government setup, if I may say so, to pursue actively the teaching role and the research per se. As I told everybody in my video that we have got at least 25 to 30 days of special casual leaves or whatever name it goes with for attending conferences per year and presenting papers and everything officially. So this advantage is there in a government setup. Then administration wise, again, yes, some of our colleagues also spoke about it, and I also spoke about it in the video. We are leaders in the OT, basically. We acquire the leadership skills, and we are also part of many decision-making groups within the hospitals. And being as part of the government, we can also assume roles at the level of the government and universities. For example, you have got Dr. Venkatesh today, GS Venkatesh. He is a well-known academician come administrator in Karnataka, and he's much sought after for his experience and wisdom basically. And of course, we can go to the NMCs also, and we visit many places as inspectors for National Medical Commission and everything. So that way, yes, there are positives, probably more positives. But again, it's somebody's individual decision to have a work-life balance and make good of whatever role they have got.
Thank you, sir. Thank you, sir. For Dr. Pankaj Gupta, I have a very strong statement, and I would want to ask him, what does he think about freelancer anesthesiologists becoming extinct over the years? What are your views, sir?
Very interesting and challenging question, I would say. I feel private practice depends on demand and supply of anesthesia services. The economic viability and stability of an anesthetist depends a lot on how he manages to work his way in that particular city. Every city in the country is different. Most anesthetists prefer settling in bigger cities, but even today, these smaller towns have a problem getting anesthetists at the right time. According to a WHO, there should be one anesthetist for every 5,000 population for the world. But in 2018, there was a report by Times of India where they specifically said that there are only one anesthetist for every 50,000 population in India. So you can imagine, only US has one in 5,000, even UK has one in 8,000. Coming to the hospitals, I feel there are about 43,000 private hospitals in India and about 37,750 government health facilities. So you can imagine the amount of work that goes on in the operation theaters. I came across a study where they counted the number of surgeries. About 2 crore surgeries were done in 2020. This is the only report which I could get all over India. So you can imagine that the workload for anesthesia is great. Now it's only for each one of us to prove our mettle, prove how good we are, work our way through, lay our work culture, improve your work conditions, which you are already doing for the last so many years in all over the country. And I feel it is going to be very good in the future, because today most anesthetists are settling in the bigger metros. In fact, corporate anesthesia services is coming up in a bigger way in a few cities. So they are competing with the private freelance practitioners. So I feel there is a lot to say about this. In between the lines, if you understand that private practitioners are always going to be there in the country, we have to adapt ourselves to the different work cultures. The healthcare policies are changing a lot in the last few years. So it is for time that we all come together, work in smaller groups, work on our terms and conditions to provide safe and quality anesthesia care. And it is very important in private practice. Unfortunately, many of us don't upgrade our skills, which I feel is very vital today. It's very important to attend conferences, upgrade your skills, knowledge, be sure of the latest know-how in the country. And I don't see any end to private practice at all. And of course, the only thing is we have to adapt ourselves to the changing scenario and the medical practice that is happening in the country.
Thank you, sir. So not yet is what he says.
Absolutely.
My next question is to Dr. TVS Gopal. Sir, you shared many advantages of working in a group, but what are the limitations? And maybe a couple suggestions for those who want to make a group for practice.
Thank you, Vibha. For freshers, these days, freshers are very keen on having their own time, which means that they will be able to get this own time by working in a group wherein there is a regulated working hours. That is one. The second aspect is that when you're working in a group, the youngsters get to combine interests and talents. And if they were to develop interest in a particular subspecialty, they can always pursue the opportunity for fellowship. For example, we at Axon offer fellowships for onco-anesthesia, liver transplant anesthesia, regional anesthesia, and cardiac anesthesia. Now, the second aspect would be to deal with income. Definitely, in terms of income, the income that a fresher would earn from a group practice would be lesser when compared to solo practice. But then not everybody who's in solo practice begins to make tons of money from day one. It takes a bit of practice, it takes a bit of experience to reach a level wherein you can be a successful solo practitioner. And that experience is best gained while working in a group. And my advice for youngsters who want to start a group is, please have common objectives. You must remember that if we stay united, we have a chance to succeed. If we stay divided, we will fail. So picking up threads after having failed with your experiment of a group practice will be more difficult, especially in a demanding situation such as ours. I hope that answers your question.
Absolutely. Yeah, thank you, sir.
Thank you.
One work area that has not been covered so far and deserves a mention is a trust hospital, which probably is a balance between a typical academic institute and a corporate hospital. Dr. Anjum, what do you think are benefits of working in trust hospital?
Hi, Vibha. The benefits definitely are, like Dr. Balabhaskar said, a better work-life balance. We're not in a rat race like many corporates are. We have better working hours. I believe a lot of corporates start work at 7 and work till 7. So we have better working hours. But having said that, many trusts pay very badly. So they may give a low salary, and our trust, for example, is more amenable to upgrading our machinery frequently. But I know that there are trust hospitals where they are very, what should I say, miserly with upgrading equipment and buying, for example, say a Sonosite machine or other equipment. They also might be difficult to increase the staff on your team because every salary counts. But very often working in an atmosphere where everybody is salaried increases the chances of doing a good job, decreases the chance of malpractice, decreases the rat race. And now with more and more charitable trust hospitals having DNBs like our institute, you still can have an academic career, you can still pursue research, you can have students, you can still teach and guide and upgrade your skills. Most hospitals are also now being run professionally by an MBA or a hospital administration graduate. So one of the irritants of working in a charitable hospital was you had to answer to a person who was a non-medical person, often a business person who may not have known any details of medicine. So that's no longer true in most of the bigger trust hospitals. Thank you, Vibha.
Thank you. Thank you so much. My next question is for Dr. Manivannan, and thank you for the encouraging video. But we really want to know the flip side, you know, being an entrepreneur, how stressful it is, especially in the earlier years. Dr. Mani, yeah, you need to unmute yourself, please.
I'd like to ask the same question to you, Vibha. Is your practice stressful?
I think what you like doing will never be stressful, and I'm sure you want to say that.
So if you love what you're doing, it's not stressful at all, actually. See, I keep telling even my children that last 25 years, not even a single day I regretted going to the hospital. See, end of the day, I may be tired morning, I always wanted to go back to the hospital, actually. So it is, stress is something, say, when all of us were talking about, say, even Anjum Madam was talking about how corporate hospitals are stressful, actually, or other people were talking about when freelance anesthetists problems. See, entrepreneurship is actually a different ball game. As I said, that any doctor can be an entrepreneur. Doctors have got that entrepreneur mindset. One thing is you can work hard, invest time to build your own organization in the initial years of life. And after that, the organization will take care of you. So I can tell certain things like, say, last 20 years, I've not gone to the hospital on a Sunday, actually, last 20 years. 25 years I've been practicing, but of course, I started my practice 25 years back. Last 13 years, I haven't given anesthesia, I'm into administration. I haven't gone to hospital on Sundays. And people are talking about leaves or 15, 20 days leave, actually. I can take leave anytime, actually. Okay, anytime. It's in my own control, actually. Of course, I'll be on the phone. That's different, actually.
So your life is under your control, actually. Okay, you are the boss of your destiny, actually. Then think about it, actually. Okay, is it worth taking that stress or risk in the earlier career days to have a better retirement days? Well, see, not everyone is successful. I'm not successful because I'm great. Vibha was a better student than me, but when I was in the right place with the right time of people at the right time, and so I succeeded. But we have great entrepreneurs, anesthetists. Say Dr. Ranjit runs an amazing course, actually, and a lot of anesthetists. When I talked about my classmate who runs a holistic center, naturopathy center, he reverses diabetes, actually, and does acupuncture and other things. A lot of interesting things are available. I wish at least 1 or 2 people take entrepreneurship. I saw all these question and answers. None of them asked how to start a hospital. It's really sad, actually. Anyhow,
I'm sure
I'm
they're
always ready to
inspired,
answer.
and they'll reach out to you. I'm sure about that. You inspired me, so I'm sure you've inspired them too. So yes, and this wraps up the second part of the webinar. But stay put, the last lap is exciting as well. And we're going to cover the unconventional career opportunities in the last lap. And for this, I hand it over to Dr. Pradeep. I know a lot of questions. Sorry, I know a lot of questions have already been answered both live as well as in the Q&A section. And I hope that many of you have already got the answers. There are a few that are, sure, go ahead.
Can I answer one question? Why anesthetists are paid more in foreign countries than in India? It's an interesting question, that's why. Can I take that now or take it at the end?
Can we take it at the end?
Okay,
yeah.
Perfect.
Yeah.
Okay.
So we went through so many doyens, in their various fields, and Dr. Mani is a very good entrepreneur and an administrator. In our survey, we found that there were some unconventional, or rather, other areas where anesthesiologists have forayed into, and most of our youngsters have not thought about it as a career option. So one of them is administration. I have here Dr. G.S. Venkatesh, who has been an administrator in various capacities as the Director of Medical Education. He has been a registrar of evaluation at the university level, and he has shared his thoughts. So
we are not able to hear it, Dr. Pradeep. Maybe you have to unshare and share again with the sound.
Yeah, let me stop sharing it.
If you find it difficult, do you want sir to speak directly? You have not shared the audio.
You're not hearing us, sir? Okay.
Yeah.
Can you hear the audio now, sir?
No, not yet. No.
So,
don't worry, I can.
Dr.
speak
Venkatesh, you can speak directly, sir.
Yeah. Good evening.
Switch on your video.
Good evening, my dear young anesthesiologist, and I'm thankful to all the organizers, Vibha Madam, for giving an opportunity to talk something about administration and the anesthesiologist fitting into this role. As all of you are aware, our specialty is so specially designed that we fit into administration like so easily. as an anesthesiologist, we are always trained to do some cockpit drills to ensure that we are well prepared before we go and do a case. Similar is the case with administration. When you want to don the role of an administrator, you need to ensure that you are well prepared for a particular meeting. You need to look at the pros and cons of the decision that needs to be taken. You need to discuss the various solutions that are required for solving a particular problem and zero in onto a particular decision which needs to be implemented. Now, if you look at these requirements, it is very similar to that of an anesthesia person dealing with a case. You need to do a pre-anesthetic evaluation. You need to decide upon what type of anesthesia you want to give for the particular case. You want to know what are the perioperative complications you expect, and you also take a plan of action of how to deal with it, and you also give a post-operative care. So if you compare the role of an anesthetist versus the role of an administrator, both the things have got a very similar type of activity. So in this way, an anesthetist is really well suited to become an administrator. Having said that, it is not that administration is all cake and there are no pains. Here you will have to deal with quite an amount of stress, especially in government sector where you have multiple bosses, and there are many type of situations where people who do not have much knowledge about the health sciences will be dictating, and you need to convince to them why they are wrong and why you are right. So it all depends upon adequate reasoning to convince them that you are in the right path and try to get whatever ideas that you have to be implemented. For an anesthetist to be successful as an administrator, you should ensure that you are a solution seeker rather than a problem giver. No higher persons likes you to pour problems to them. They want some solutions to be given. So you should always try to ensure that you need to be a solution seeker rather than a problem giver. Having said that, the question arises, is an young anesthesiologist ready to take up the responsibility of an administrator? I think he requires at least 5 to 6 years of little bit of exposure before taking on the role of an administrator. But if you have an aptitude for administration, and if you get into that groove, you are going to really be successful. As some of my colleagues said that, like Manivandan sir, when he said that a job which you like, it never tires you. In the same way, an administrator role is from morning till evening. There are nothing like breaks, but once you start enjoying it, you don't know how the time flies. Even in the morning, we'll say between 8 o'clock to 10 o'clock, we will be on calls trying to answer many questions, many problems, and we don't know how the time has gone. You go to your organization, start getting involved in the work, you don't know how the evening has ended. So, I mean, once you get involved in the work, you definitely start enjoying it. But the most important thing that you all remember the aptitude is the most important thing. In case if you have the aptitude for administration, you can become an administrator. Otherwise, it will be a very difficult situation where you will never be comfortable. So, my dear young anesthesiologist, I feel you can always think of administration as a possibility in your career, provided you have an aptitude for that. Thank you.
Thank you, sir. Now we have someone who has, again, taken a different course. We have Dr. Lulu, who is the director of the Simulation and the Skill Center at Father Muller College. She'll be sharing her thoughts.
No.
Are you able to hear?
Share the audio
No.
also. Share the audio.
Yeah. When you say share, there is a box that says share sound, and you have to tick that. For that, you have to unshare
screen
first.
also you can check, doctor. On top of the screen, you see a green bar over there. In that, you have view options. Just try there. There is a share option button if it is there.
Yeah, it's there.
You can just click on that, share sound.
It's not showing share sound. That's the problem. Okay. Yeah.
Should we ask her to talk live?
Should I share it from my end?
Yeah. I think it's better you share it from your end. Do you have the videos?
Yeah.
Yeah. I'll stop sharing.
Hello everyone, I'm Lulu, Professor in Anesthesiology at Father Muller Medical College and presently heading the Father Muller Simulation and Skills Center. So my entry into this field was quite accidental, with the Dean requesting me and my colleague Dr. Ritesh to set up a skill lab. I did it part-time. I used to enter the OT and then again come here and try to run the show. But I was so passionate about teaching and I didn't have much private practice. So it was quite easy for me to transit to a full-time educator and a full-time administrator at the skill lab. I've done a few certifications internationally. I've completed my basic course in medical education as a 5-month graduate and in professional education. I've also completed my master's in healthcare simulation and patient safety. There are a few certifications available. There are societies in India if you're interested to complete the simulation educator courses. What is the present scope right now? Post the NMC CBME mandate of setting up skill labs, there is a huge void of skill lab in charges and simulation and skill educators. So if you're interested in academics, this is the path I would advise you to take. If not full-time, at least part-time, along with your clinical practice, you can balance it. It adds value to your CV and it helps in your appraisal. Remuneration, being in a private institute, is along with your salary, you do get incentivized for the extra work you're doing. There are posts available in the Middle East for simulation trainer, simulation research assistant, specialist. So if you're interested, that is the path I would advise you to take. Thank you.
The next person is going to be a very interesting person. He's Dr. Avnish Khare. I think most of you have heard about ChatGPT, generative AI. Dr. Avnish Khare has totally dedicated his time towards AI and medtech consultancy. And he does a lot of courses on AI also, especially for doctors. He's associated with BrainX. Can we have that video, Dr. Venkatrama? The next video. Yeah. Yes, this one.
Hi, my name is Dr. Avnish Khare, and I am a physician turned Med-AI educator and consultant. I started with and practiced anesthesia, critical care, and pain management for around 10 years. But as my journey unfolded, I felt a magnetic pull towards a different path, one that would allow me to make a broader impact on the medical landscape. With a burning desire to bridge the gap between medicine and technology, I finally transitioned into the field of Med-AI education and consulting. Other than educating medical professionals about AI, I also help medtech startups and companies navigate the complexities of the healthcare industry to develop innovative solutions that address the most pressing challenges in medicine. I think AI would make an impact on anesthesia practice 10 years from now because AI can process vast amounts of patient data, enabling better risk predictions, real-time monitoring, optimized drug dosing, and personalized post-operative care. This technological advancement has the potential to improve patient safety, outcomes, and overall efficiency in anesthesia procedures. To become a medtech consultant, you need a growth mindset, a lifelong learning attitude in areas beyond medicine, and a lot of networking skills. As it is an evolving field, the future is still not certain, but one thing is clear. The demand for skilled and knowledgeable consultants with domain experience is likely to increase. With advancements in medical technology, data analytics, and artificial intelligence, there will be more opportunities and challenges in times to come.
Thank you, everyone. I now hand over to Dr. Vibha.
Yeah, and that brings us to the end of this webinar. So I'm going to ask Dr. Balavenkat sir to thank everyone, our panelists, as well as the attendees for staying put so long. It's been clocking beyond 2 hours since we started, and to give us concluding remarks. Sir, please.
Thank you so much, Dr. Vibha, for carrying on that session so brilliantly. And the panelists did a wonderful job and excellent exposition of what they've gone through life. To all the participants, number one, I just want to make all of them feel happy internally. Tell yourself, when lakhs of people, students wanted to become a doctor, only few thousands could become. When all those 1,000 wanted to do a post-graduation, only hundreds managed to become. And be very, very happy and content that already you have accomplished quite a bit by being a professional, being a doctor, and being an anesthesiologist. Now, it is important that you have had excellent insights into several specializations. But I would want to convey to you, you need to do what, as I told in the beginning, what is the gap that you have? What is that you want to improvise upon? So it becomes, that's very important when you choose what you want to choose. Second, it is also important that you build a very happy family. If you run for several professional accomplishments, I do not want you to leave behind a family which is deprived. So I think the first 5 years, when you completed your post-graduation, when you are looking for your life partner, I think you also have to make sure that you have enough time to build a family which is going to become rock solid. So I think you need to think on certain facets of your growth, which also involves building a very strong family. And a special request for the young women anesthesiologists, because I have opportunity to deal with several of them. Do not hesitate to take a break in your professional life for the other requirements that you are expected to do, like getting married and becoming a mother. I think though this is not a component of the webinar, I thought it's very, very crucial and important for you to consider these aspects. Take a break. Do not feel very guilty for taking a break, but bounce back into that once you've completed those tasks. And there are certain questions which were asked. Is there an age limit for you to do specialization? In some areas, it's like 40 years, but then in majority of the places, there are many open virtual online courses where there is no limits. So specifically, I wanted to tell you that you need to play the roles very carefully. And another important introspection that you need to do is, where would you want to settle down? Whether it is going to be a metropolitan city, or whether it's a 2-tier city or a 3-tier city. And based on that, the compulsions of the family, the compulsions you have, you need to become the most respected anesthetist of whichever small city that you settle in. Primarily, every surgeon should think the minute you walk in, they should think that this patient is going to survive. The respect that you earn is based upon the knowledge, the skill, and the wisdom with which you use both. I think you need to channelize your thoughts to acquire this so that you become a power to reckon in the place where you work. So today, you had a lot of insights, and the only thing which we didn't touch upon is doing something outside India. A decade ago, this would have been something very, very, very interesting. But now, with India becoming a power by itself, India having institutions which can offer the best in the world, I think that particular question doesn't arise in terms of training. And in fact, all the leading centers, we can match several centers equal to the best in the world, which can offer you the same kind of insights, both in knowledge and skill, like the best of any other universities across the world. So I think India has got the power to transform, the energy to pass on to each one of you. So I'm sure that the next decade belongs to this country. And you as youngsters have to make the dreams of the nation come true by your immense contribution into the specialty. Also incorporate a lot of documentation, the data, work on the data, whether you're a neuroanesthetist, a cardiac anesthetist, or a pediatric anesthetist, or a private practitioner. Please accumulate the data and make sure that you publish it and make sure that you put India in the global map. I think this is going to come. And always tell yourself that you need to have a very, very strong culture when you enter the operating room. And I would strongly request, please make sure that your mobile phones are kept at bay when you enter the operating room. This has been the concern of several surgeons. So when we think a lot about specialization, it is also very, very important to have certain important component like the operating room culture, the integrity, the honesty, and the communication that you would do to the patient. In a nutshell, this webinar was to show you insights into the possibilities of grooming you and your career. But we also wanted to tell you, you have to be an excellent human being, plus an excellent accomplished professional. And we had such a variety of insights from all the panelists who are themselves so busy. And I'm very, very happy that they could give their time to share their thoughts and expertise. And I thank Dr. Pradeep Dongre for the survey that he conducted to know the insights in the mind of the young anesthesiologist. Thank you so much, Dr. Pradeep, and Dr. Vibha, who did all the hard work, took enormous efforts to communicate to all the panelists and set up the questions, did a trial run. If the webinar went flawless, it is because hours of midnight oil was spent on it. And in fact, we had a mock session yesterday, which also took 2 hours. Every question was analyzed. Every word of a question was analyzed, the meaning that it conveyed. It clearly shows that you need to put in a lot of efforts and hard work, and you need to be very sincere in what you wanted to do. So you will be a shining star, not only in this country, but for this entire world. Vibha, thanks for doing it. And I'm sure that it's an example for all youngsters that they need to follow such good qualities that they need to imbibe to become one. So my sincere thanks to all the panelists and all the delegates who had come in large numbers. We are very, very happy. And we will, all the recorded version of this will also be in the YouTube. We will share it with you. So all those of your friends who could not be a part of this webinar will have an access to the information that this webinar conveyed. I would thank OCAD for giving this platform, and thank you, Venkat, for being with us all the time. And Vibha, the last word is for you. Thank you so much, and really, really happy that we could conduct a session like this, and I'm sure we'll do much more in the future. Over to you, Vibha.
Thank you, sir. Thank you. I really want to thank everyone from the bottom of my heart. Bala sir for inspiring, Dr. Pradeep for supporting. There's one more person, and that's Dr. Nilesh, who's also helped us in curating some of the components of this webinar. All the panelists who've prepared such wonderful videos. I'm really sorry. I would have asked 1 or 2 people to kind of re-record it, and I'm really sorry. I just wanted the experience to be really good for the attendees. And thank you so much. I see like more than 150 questions answered. I think this is a humongous task. Thank you for sharing such valuable information. And last but not the least, our attendees. I see more than 225 people still clocked in. I'm sure they wouldn't have had food, and it's beyond 10:15. So thank you, everyone, and stay safe. Take care till we meet again. Bye-bye. Good night. Logging off now.
Yeah, thank you.
Thank
so
you,
much.
Bala sir, and thank you,
Thank
Vibha
you.
ma'am. Thank you.
Thank you,
very
Dr.
much.
Good night, everyone.
And
Was a
waiting
great-
for a solid, progressive India in the anvil. Thank you. Thank you so
Thank you.
much.
Thank you.
Good night. Bye.
Thank you so much.
Good night,
Thank you.
everyone.